Hello, everyone. Welcome to Dean's Chat, where we discuss all things podiatric medicine. My name is Dr. Jeffrey Jensen. I'm the host of the Dean's Chat podcast and the Dean at the Arizona College of Podiatric Medicine. Once again, I'm joined by my co-host, Dr. Johanna Richey. Hi, Jo.
Hi, Jeff.
How are you doing today?
Oh, I'm good, thank you. How are you?
I'm doing great. Thanks for joining us again. And we have a fabulous guest today, Dr. Kyle Fiala. Kyle, welcome to Dean's Chat.
Yeah, thank you. Thanks for having me.
Oh, no problem. We're fairly informal on Dean's Chat. And if it's okay with you, let's go first names, Kyle and Joe and Jeff.
Perfect. Sounds great.
Fantastic.
Well, thank you so much, Kyle, for taking the time today to come chat with our audience about all your experience and an opportunity for us to get to know you better. So Dr. Fiala graduated from the University of Missouri, the Columbia campus with a bachelor's in biologic science, and went on to the Kent State University College of Podiatric Medicine. He completed a three-year surgical residency training program at Truman Medical Center, Lakewood in Lee's Summit, Missouri. And now he's clinical professor of orthopedic surgery at the University of Missouri. So back to your alma mater, it sounds like.
I am.
Go ahead.
I had a brief little stint away from my alma mater, and I'm right back where it started from.
I can feel it. I have been wanting to come back home forever, and it's been nice to get back home. So Dr. Fiala is also board certified in forefoot and rearfoot reconstructive foot and ankle surgery by the American Board of Foot and Ankle Surgery. He's a fellow of the American College of Foot and Ankle Surgeons, and he's also AO North American faculty. He's been in academic medicine for 12 years, and we're really excited to have you on Dean's Chat. So thanks again.
Absolutely. Happy to be here.
So I know you have some interests specifically in arthroscopy and sports medicine, but also trauma and total ankle reconstruction. Can you kind of give us a little rundown on kind of what your days look like?
So, our practice is pretty unique. I mean, it's a level 1 trauma center and at the University of Missouri. So we see just a wide range of pathology. And we are kind of a safety net hospital, which I think it keeps things very interesting. But typical day, so I operate Monday. Tuesday, I have clinic all day from about, I think we start about 8, and depends on the day, we'll, end around 5, maybe a little bit after. Wednesday, I'm in academic medicine, so Wednesdays are usually our academic days. So we have meetings in the morning. So, it'll be like M&M conference, which is morbidity and mortality conference. 1 week we'll have grand rounds. Another week we'll have a faculty meeting. Another week, and then the fourth week is kind of a flex. We might have another grand rounds or some type of didactic education that we do. So that's about an hour and a half in the morning on Wednesday, and then I operate most of the day on Wednesday. Usually finish up again around 4 to 5. Thursday is all day clinic again, and then Friday is kind of a flex day. They call it our admin time. So, if we have extra cases we need to do or add-ons, let's say we've got some inpatients and things, we can use that. I can add in another clinic if I want to, or I can use it for research purposes or working on presentations, conferences. Or if there's not anything going on, then I have a day to kind of hang out with my family or take my kids to school and just kind of use the day as I feel like I need to.
That's fantastic. And being in the academic medicine world, something that's kind of unique for you is you're in the orthopedic surgery residency program. Can you talk a little bit about that experience?
Yeah, it is definitely something that's a little unique. I think it is probably becoming maybe a little bit more popular in the U.S., but outside of my residency many years ago, I don't really have much knowledge of what happens within the podiatric residency world. So I am fully in the orthopedic surgery world. And I've been that way for 13 going on 14 years. So it is definitely a little different, but it's fantastic. It's awesome. And I wouldn't trade it for anything. And it is very unique. Again, it's kind of being into that kind of ortho world and being included, as a podiatrist is something pretty unique.
Absolutely. We as residents had the chance to be kind of the orthopedic resident for 3 years. We were cheap labor, which was great. And our orthopedic colleagues were fantastic and treated us just like any other resident. And the educational opportunities that we got to benefit from them was immense. And even though, you're in the ER and you're reducing a wrist, the reduction principles, splinting principles, open fracture management, these are principles that are common across both specialties, right?
Yeah.
So I think there's such a huge value. And what a neat opportunity to interact and engage with the orthopedic surgical residency program.
Yeah, it's really pretty cool. And like I said, I think we've talked to like AO, like, those principles ring true, whether it's, a hip, a knee, a foot fracture, ankle fracture. That was one thing that really struck me is they really stick to those principles. You hear about it in residency, you hear about it in school, but to actually like see it not only on like the foot and ankle world, but kind of on the bigger picture, it's pretty special.
So Kyle, when you're doing cases, are you working with the ortho residents then, right in on your cases and you're training them?
Yep. So up until a few years ago, the sole kind of foot and ankle faculty here at the University of Missouri was just myself and another podiatrist. And so it's just a one-on-one kind of a relationship. So right now we have third-year residents. We used to have the fourth-year residents, so kind of a more senior level resident. And they work right beside us. So, and we're responsible for their foot and ankle training. We do all the didactic, teachings and conferences and journal clubs and all of that. So it's, and the residents really like it. Out of all the rotations that they do, we're always very favorable or rank high on their list. So they seem to get a lot out of it. They seem to like our style. And I think it was one thing, and I don't know about you, Joe, like with your residency, with my residency, it's, it was very hands-on and it is very much like a graduated autonomy kind of approach, right? Like your attendings, once they got to know you and kind of know your skill level, you could really basically fly, right? Like you can kind of run the case or do a lot of the work. And I think our residents, myself and my partner have kind of taken that philosophy too, and we kind of let our residents go. Obviously, we're there and we're watching them and we're guiding them and we're making sure nothing, is bad going to happen. But I think they like that freedom and that autonomy to kind of be themselves or kind of grow and figure out, hey, how am I going to do this? Or I reached a little point where I'm kind of stuck. Well, how am I going to work that out? How am I going to get out of that? But we're obviously there to help them. So I think that's, they tend to respond to that well.
It's so interesting as I'm listening to you talk, this idea of that safe failure, right? Not failure, but safe exploration, maybe allowing residents and students and fellows the opportunity to have to kind of think ahead and, well, let's see what happens when you do it your way, the way that you're thinking about it. And again, in a safe and a controlled manner, but those are the most amazing learning opportunities because they won't forget what happened when, they didn't have a secondary point of fixation and they go to put a screw in and everything starts to fall apart or whatever it is, right? That opportunity to experience it, not have somebody talk it at you, but like, oh, gee, yeah, I guess that's why you do that is so valuable. So I think that's such a neat experience. Yeah.
And I learned things from them too. Like my resident now is great. They have a recommendation or they have a way that they think this, whatever we're doing, could work. And I like to sometimes sit back and say, okay, well, let's see what happens with that. Right. That's how I kind of learn and grow too. But I always love that. You can always kind of see when they get to a point, I don't really know. This isn't quite the way I want it to go, and to see them get to that point and then see them work through that to get to a solution. I think it's pretty cool. And to be able to kind of guide them through that, is pretty cool.
And having that opportunity to collaborate with each other and engage in that creativity of, again, how we start to make some of these advances in medicine is you take something from one area and you're like, gee, that makes a lot of sense. And then you apply it maybe in a new way or in a new technique or something similar, but just slightly different. So again, what an incredible opportunity for them and for you to engage in that and really just make your patient outcomes better.
Yep. Well, you never know where that might lead to, right?
Mm-hmm.
Like, it could lead to, a research project, or, we could develop something, a new way of doing things. And, so it is pretty unique.
Yeah.
Kyle, after you finished your residency training at Truman, how much time was between finishing your residency and joining the faculty at the University of Missouri?
Not very much at all. I think, if I always tell myself this, if I could go back, and do things differently, I probably would have taken more time, maybe. I think I graduated in, I don't know, May or June, and I think I started in August. So there was no time. It was like we moved, from Kansas City to Columbia, which is about 2 hours away. And I wanted to start working as fast as I could. And I guess in hindsight, probably should have taken a little time and, gotten acclimated, gotten moved and all of that. But I was ready to go, and I was hungry, and, I had student loan debts that needed to be paid off, and I had a new family. I think my son at the time was 6 months old. So it was time to work. So it wasn't very much time.
When opportunity knocks, you got to jump on board.
That's what it was. Yeah. So it hit the ground running, and there was a need, I think, there was, when I first started, there was kind of an older orthopedic foot and ankle surgeon, and that was it. So there was only one foot and ankle faculty, and so there was plenty of work to, when I first started. So it didn't take much to get busy.
Fabulous.
How did you find out about that job? Was it connections from your undergrad, or?
No, it was, I had done some interviews with some attendings and some colleagues in Kansas City, and I wasn't really happy with some of the offers and kind of the prospects there. It was in Kansas City at the time, it was like, well, you're going to go and be an associate for somebody for X amount of years, and you're going to get, all the formulas and things of getting paid, and then at a certain point you have the opportunity to potentially buy in. And, there was a few of those, and I wasn't super happy with those. And so I think one night I just sat down and I was sending out random emails, and I got in touch with our current practice manager. And we were sending emails back and forth. And she was like, well, can you come tomorrow at 8 a.m. for a interview to meet our chairman? And I was like, yeah, I'll be there. Yeah, no, I'll be there. So I showed up at 8 a.m. and did the whole interview all day. And I think they liked me enough to offer me the position. So I think it just really came down to probably timing and being at the right place at the right time. They also had somebody lined up for the job, and they backed out at the last minute. So it just really, I'd like to say that it was like I had this great resume and this great CV and everybody knew me, but it was just basically cold calling and sending an email and being willing to, to show up the next day, or whenever they needed me to be there.
That's outstanding. Often the way it goes, right, Jeff?
Oh, man, isn't that the truth? Well, that's what happened to Jo. She joined us at the Arizona College of Podiatric Medicine, and she'd been a graduate of the Arizona College and had all this wonderful experience. And it's amazing the way things line up sometimes, isn't it?
Yeah, it's, everybody's got their sayings, but I always say things happen for a reason. And I think it's, I'm a true believer in that.
Jo, share with Kyle, it was like Christmas today at the Arizona College, in our lab. If you don't mind talking about the ankle arthroscopy things, that'd be great.
Yeah, and again, we'll circle it back to some of your interest in arthroscopy, and especially working with orthopedic residents, because I know for the competency-based equivalents or exams or whatever their statutes are for their training programs, they're required to do simulation training for arthroscopy. Yeah. And currently in podiatry, that's not a requirement. I feel like the arthroscopy training is maybe haphazard and maybe not as standardized, and not necessarily that it needs to be quite as rigorous, but you don't really know what your experience is going to be as a resident, because it hasn't kind of been a little delineated. And one of the things that I know you kind of already know a little bit about, and so does our audience, so we won't speak too much, but we got our actual simulators today. So it was genuinely like Christmas. And I was just over there with Joe Manders, our rep, who's been outstanding to help support us. And so we're going to start rolling out some research studies and some training, actually, even for students, so that by the time they get to their residency level, they have just the tactile skill, because it's a completely different skill set than most other things that they're probably doing. What is your experience with the residents in terms of the orthopedic residents coming in at a third or fourth year and their ability to kind of jump in with arthroscopy? What do you see?
Yeah, some are better than others. I think that's just like anything else, some don't have or never had a lot of that experience of the, arthroscopy is different. It's different than any other thing that we do. And so there is definitely a learning curve to it. And some are pick it up a lot faster or easier than others. But it's all just experience. And, I think I've been faculty with ACFAS for the scope course for many years. And I've seen the change over the years. When I first started doing it, those first few times they had the scope, it was like, it's going to be a long weekend, and fast forward now, they've shortened the course down. I think they've cut out a lot, but the skill level of like the residents coming in is so much better than what it was, 10 years ago or whatever it was. So, it's just a learning curve. And I didn't have much experience with arthroscopy when I did my residency. I actually hated it. The two things that I hated the most are the two things I love the most now, which is arthroscopy and arthroplasty. If I could do those procedures all day long, I would be very happy. And so I've had a very kind of a full circle experience with that. There were things that I knew that were very important, as a very good skill set to have. And I wanted to learn those. So there definitely was a lot of growing pains, at least from my own, journey with that. But it's well worth it. Yeah.
That's really interesting. And again, kind of leads back to the idea of a lifelong learning, right? Yeah. And I love that you voiced that, like, hey, these were things I was not strong in, didn't really love, didn't really expect to do it, but now I actually love doing it. Because oftentimes Jeff and I get questions from students like, they either already know where they want to focus their energy, right? Oh, I like this about podiatry, or they have no idea because they don't know what they don't know. And so even trying to help direct sometimes like the very narrow focus, like this is what I want to do, it's all sports medicine and nothing else, that may change, and it's totally fine if it changes. So I think that's a great thing for some of our audience to hear.
Yeah. And it's they call it a practice, right? Like it's something that's constantly kind of evolving. And, I fast forward in my life 10 or 15 more years and my practice could be completely different, or my interests could be completely different than they are now. So
on that, how did you get better at those things? What did you go to specific courses? Did you seek out mentors? What was your...
Yeah, a little bit of both. I just started small with so like if we take arthroscopy, I just started small. It was like, if I'm going to take out some hardware, well, I'm going to do a scope, and I want to peek in there. I do feel like maybe there's some impingement or some scar tissue. I want to look around. And so, that was a way to kind of get a little bit more experience. Or it was like, I think they have some impingement, and it's very simple, very easy cases. And you just kind of build your reps that way. And I say this in the scope course, I tell my residents this, I'm very much a creature of habit. And so I think, like, at least with arthroscopy for me, like 90%, I think of success is kind of the setup and the lead up to it, of like, making sure the patient's positioned right, and you have the thigh holder and the distractor and all of the things. You do your pre-op planning, and if you get your portals right, the rest of it's pretty simple. And so I'm very much like a KISS philosophy, right? Keep it simple and stupid. And so I try to kind of live by that. And so I just kind of kept building up, getting the reps, and then I expanded into kind of maybe some more challenging and difficult, cases. And then I became a faculty for the scope course. And with that, like you're with all these great colleagues and they're showing some of the things that they're doing and some of these cases, and you're like, this is amazing. And I'm going to go try that. Like, I'm going to, Hiro Shibuya's, he put a video where he does like the subtalar joint scope fusion. And I'm like, yeah, this is amazing. I'm going to try this. So it was something like that. And then with arthroplasty, it was my partner, he had quite a bit of experience in it. So we just basically started doing cases together. This was back a long time ago. We had the big jigs, like this was before kind of like the patient specific, instruments and implants and things like that. And so we just did them together. And so it was like having a buddy system, having a mentor that, was there to help me out if I got kind of stuck. And then it was another way to kind of basically double my experience, double my numbers, because I would scrub in on his cases when he was doing them. And so it was a way to kind of get that experience that I didn't have. And then from there, it was just getting more comfortable, more used to it, and started doing more difficult, cases.
Yeah, that's excellent. So again, when we think about some of the people that might be listening to the podcast today, there's the prospective students, there's current students, there's residents. And then I think there's certainly, seasoned faculty, we'll call them. But I think there's also a lot of early faculty or attendings, or they just got out of residency or fellowship. And, they're that learning curve, those first 2 years of being an attending surgeon all on your own. And knowing that it's okay to not have everything and feel totally comfortable with everything, and being able to reach out to somebody in your community if you don't have necessarily a partner maybe, or if you do have people in your immediate group, reach out to them and say, hey, this is something I really want to do more of, or I'm really interested in. I see that you do a lot of them. Can I just come with you? And building those networks. And I think that's useful for people to hear. I know certainly for me, it was so therapeutic to hear my colleagues be like, oh yeah, when I came out, I wasn't totally comfortable with that. And it's like your head spins around like, oh, so it's not just me. Like we all need support. We all need support. And even as you get, mid-career, if you choose, hey, I'm really loving this one little area and I want to do more of it, finding ways to build your guardrails to be safe and get the training and education that you need. And we're lifelong learners.
Yeah. And, being in a large kind of a department, we've got, 30 plus surgeons, and there's a lot of collaboration, even kind of in the ortho world of, people kind of double scrubbing or helping out on these cases, a lot of collaboration. And, so I would tell, anybody out there that's not a bad thing. Ask for help. If you feel, uneasy about it, or maybe don't have quite that experience, like phone a friend, have somebody help you out, because you'll get that experience. You'll learn more. It's better for the patient, and there's nothing wrong with that. And I would say, even for the first 5 years, everybody will say, the good cases are good, but I learned way more from the things that didn't go well than I did from the things that went well. And I think, it is tough and it is a struggle sometimes, but it makes you better.
Yeah.
Kyle, being at a level 1 trauma center, what are some of the interesting things you see come through the door?
You name it. I think I got last week, we had like a young patient that stepped on a huge razor blade that had a razor blade sticking out of their foot. I don't know how that happened, but it happens. But we've seen all the gamut of things that can happen, from, gun blasts, gunshot injuries, Columbia's kind of unique. We have a major interstate that comes through, so we get a lot of MVC and kind of vehicular trauma. So we see a lot of that. Chainsaw, injuries, or lawnmower stuff. That's pretty common too. But it's never kind of a dull moment. There's always something kind of unique and challenging that we see. So keeps it interesting.
I'll bet. That's great.
So Kyle, take us back to young Kyle, when you were maybe high school, maybe early college. Were you already interested in podiatry? Did you know that was the route that you wanted to go?
I had no clue. I had no idea what podiatry was until I was, junior or senior in college. So I always kind of knew I wanted to do something within the healthcare industry. My dad was a pharmacist, and my mom was a nurse in the ICU. So I was always around medicine. In high school, they had like a program, like they called it Medical Explorers. I don't know if that's still around or a thing, where, basically you could go around and shadow like different parts of the kind of the healthcare industry, right? Like nursing or like, this doctor. And so my mom worked quite closely with some cardiothoracic surgeons. So she kind of pulled some strings for me. And I think I was maybe 17 or 18 at the time, maybe, I don't know. I was able to go in and basically watch an open heart surgery. And so, I guess everybody who's been in an operating room, for their first time, it probably goes two ways, right? Like either you're like, this is not for me, or you're like, I want more of this, right?
Yeah.
Like this is what I want to do. And so that was kind of one of the moments for me was, I was like, this is something that I want. And then fast forward into college, and I don't know. I think I got kind of distracted by college and things like that, and so I kind of lost ways with the kind of traditional medicine road. And I think it was like junior year, senior year. I was like, I got to figure out what I'm going to do with my life. And I had some colleagues or some buddies that one of their dads or fathers was a podiatrist. And so I did some shadowing, and I was like, this is something that I can do. And then I think I did a tour in Cleveland at the school, and I was like, I think this is where I'm going to go. So it wasn't like, I had already, I knew this from a very early age. I didn't know what podiatry was until, again, it was pretty later on. And I probably, even when I signed the admission, papers or whatever, I probably still didn't know exactly what I was getting into, so that's how I kind of found me, I guess.
Well, it's always good to have friends that have parents that'll let you come in and shadow and give you the full experience.
Yeah.
When I was in podiatry school, I went to California. My best friend in podiatry school, his dad was a podiatrist over in Oakland. And so we used to go over to his office and kind of hang out and visualize what the future might look like, right? And that had a tremendous impact on me, for sure.
Yeah. And again, things kind of work out the way they should. And, I think I've been very lucky and very fortunate that, that this has worked out, the way that it has. So.
Very good.
So I have another kind of segment question. We'll kind of shift just a little bit, kind of along that idea. So you had mentioned that right after residency, I think you said you had just had your son, maybe 6 months old, something like that. So you have a family, and you have a very busy practice. Level 1 Trauma Center is a very busy practice. How do you merge those two life experiences?
Yeah, it's again, it's something that's kind of constantly evolving. And it is very important, like having a very good kind of work-life balance is important. And I think having a good supportive partner, I could not do what I do without my wife. And I think vice versa too. So we have a good relationship, a good partnership, but I think when I first started, again, I was hungry. When we moved here to Columbia, I had no money to my name at all and a massive amount of debt. And I was hungry to work. And so I think early on in the career, I worked a lot, a lot of long hours. But, that allowed to, pay off some of my debt and kind of get established, and we started having a few more kids, and and fast forward to now, it has kind of evolved to where I am stepping back a little bit, or not maybe working as hard as I had, because it is important to be home and to be with my family, and I don't want to miss those things because I was working super long hours. And and then also I look at, longevity. I don't think I could keep up that pace that I had when I first started, because I would burn out, and I think everybody goes through little phases of kind of burnout where you're just like, I kind of need a little bit of a break. And so I think I'm at a point now where it's like, what can I continue to do for the next 10, 15, 20 years that's sustainable, that is not going to, have me burn out or, be unhappy at home. And, that translates to patients pick up on that. If you're, not feeling your best, and, you're not going to give the care that, you normally would. So that's kind of, where I've moved towards, is trying to find that happy, like, work-life balance.
Yeah.
Kyle, how old are your kids now?
They are 13, 10, and 8. So it's, it goes by fast. It's kind of a blink of an eye. I'm going to have a high schooler, or then, soon kid will be in college. And so it's, this time, at least in my life, is precious. So
they're busy times, but they're the best times too.
They are. Yeah. We have kids and everything. So it's like every night of the week we're, running around doing this, doing that, and the weekends and stuff. So it's definitely getting busier.
Joe keeps our entire office filled with Girl Scout cookies, so it's awesome.
I'm the supplier. Yeah.
Yes.
Absolutely.
And it's true. I mean, I was just talking to 2 different students this past week about, trying to figure out how to set up externships and figure out, mapping of a life, and how do we incorporate all these things. And in fairness, they're like, should I incorporate these things? And the answer is yes, right? Like, you are not going to be the best version of yourself if you ignore half, at least, of what's making you you. So it's, not everyone has the same constraints. So tailoring something and designing the life that you want, and not at the sacrifice of your training and your experience, your opportunities, but to the betterment of it, and figuring out how to pull the things that really matter from both of those and make it happen. And that's not an easy proposition for anybody, but setting up that framework. And I love that you said that, at the very beginning of the interview, when you were talking about, looking back, it maybe would have been nice to have had a little more of a runway to kind of figure those things out. But the reality is we do expand, and we can take on sometimes more than we think that we can, but we have to be willing to do it. We have to be willing to show up. They called you for an interview and you said, okay, yeah, I'm going to go. And that one decision changed the trajectory of your life. Like, those things wouldn't happen if you don't show up. Right. And so, I think for the students that are listening and trying to figure out, how do I make all these decisions? I don't even know what I want to do in podiatry. And I would say what you want to do is maybe less relevant right now compared to, how do I want my life to, like, these are my 3 years to invest. How do I want to invest them? And what trade-offs am I not willing to accept? Or maybe am I going to look back in 3 years and say, I really regret that was the decision that I made. And thinking of how do you build your guardrails to not let those things happen? Because, somebody may have different priorities, and that's okay. But you don't want to look back and be like, gee, I wish I didn't do that, versus, I probably could have done something differently. I think we all look back and say, yeah, that would have been nice if, or I probably would have done X instead, because that's learning, and that's life, and that's trial and error, and that's supposed to happen, versus, true regret. Like, oh, I should have taken that other program because I would have gotten better training. And instead I was tired and I decided to take this other program because it was, easy, and I missed out. Because that was your chance, So I love the layers that you've been kind of building. And as I'm taking it and applying it to these conversations that I now have with students that are my favorite conversations to have, I think it's such valuable life stuff.
Yeah. And there's a lot to be said too for, like, self-motivation, and I think that's, when we do resident interviews and things, that always kind of comes up, as like an attribute of, guys, I guess, who we look for, for prospective residents, and for myself, like, I wanted to get as much experience as I possibly could, in residency. And so I think even if you're in let's say, somebody's not quite where they want to be, or let's say maybe they made a decision they somewhat regret, you can still make the best of it, right? And so I think that's at least my experience with podiatry was, if good things come if you work hard and you put in the effort and show up, right? Like there were times I would drive halfway across Kansas City or to go other places in that kind of region to cover a case. It may have been a case I've done a lot of times, but I still wanted that experience. I still wanted to be in the operating room and to build my skill set. So, I think you can still have, success, but you have to put in the work and the effort, and you have to show up to do that. So.
Yeah, absolutely. And actually that's perfect. So advice, we'll go prospective students that are looking into healthcare. What would you say?
Well, I would definitely, it's a long, hard decision of is this something that you really want to do? Right. And I think it shouldn't be about the money, right? Because no amount of money in the world is going to make up for all the long hours and all of the late nights and all the stuff that we have to go through, because it's a lot of work. And I think you really, truly have to do it for the right reasons, right? So, so you shouldn't look at that like the money aspect of it. You should go in because you like medicine or you like ultimately helping people, right? That should be number one. And then, work hard. Put in the time to study and put in the hours and build those relationships and connections with, your fellow students, your co-residents, your attendings, because you never know again where that will take you. And then and work hard. Nobody's going to expect anybody to know everything because nobody knows everything. And so there are going to be times where you don't know it, but that's okay. But as long as you're willing to learn and to grow, that's, I guess, my advice,
That's what all the residency programs are looking for, the students that work hard and are willing to grow and are teachable and get along with others. And it's just such a great opportunity for students rolling into that residency situation. So that's great advice for prospective students. How about any additional advice for residents? Because the match day is Friday this week. Our students are going to find out where they're going. You said work hard and be inquisitive, and anything else you'd like to tell them?
Yeah, I think be a team player, I think is very important, right? You can't do everything by yourself. So, being able to work well with others, I think is a good attribute. I think being self-reliant and self-motivated is a good attribute. I think being resilient is another really good, quality of, being able to bounce back, or how do you pick yourself up if, you're not doing well, or, you made a mistake or something happened, right? How do you kind of learn and grow from that? With residents, nobody's born a great surgeon. Nobody's born a great physician. That's something that's developed and made over time, right? So you have to be willing to learn and to go through that process, to come out on the other side successful.
So well said.
Yeah.
So Kyle, what do you do when you're not, I know you hang out with the kids a lot and you're working a lot, but what do you do to kind of recharge the battery on your own? Do you have any hobbies or sports, or how do you do that?
Yeah, it's, I think probably since COVID, I've really tried to kind of, look at myself a little bit more, or take care of myself better, both physically and mentally. So, I try to get a workout in, or some type of physical activity, every day if I can. I try to find time to kind of decompress, whether that's meditation or journaling, or I try to find some time to kind of get away where it's quiet and have some thoughts, to kind of decompress a little bit. I like to get outside. So anything that can put me outside when the weather's nice, and we don't have the beautiful Arizona weather like you guys do a lot of the year, but, trying to get outside and be active. So whether that's riding a bike, here in Missouri, we have a lot of the rail to trails, where they have become the old railroads, they've turned into trails. So getting out on a bike, or we have a little Labrador puppy, so it's like taking the puppy on a walk. And a lot of things with my kids. It could be just shooting hoops in the driveway, or going on a walk with my kids. I think those are things I do, and I do like to fly fish. So that's probably my one probably vice. So some people golf. I like to fly fish.
That's a total addiction.
Yes, it is.
You hit on one of my favorite topics earlier. You said you meditate a little bit. How'd you get into that?
I think again, it was kind of just during COVID, not a lot was really going on. And I think I probably started listening to some podcasts, and I probably went down a rabbit hole one night, and, I think I kind of focused on making myself better. So there's, something like that. So sometimes it's just like, I'll put on some music, or I'll put on something that's just kind of relaxing. And I just, I'm not really having a lot of thoughts, I'm not thinking about signing notes or the consults I got to see, or like, oh my gosh, I've got this, meeting coming up. It's just kind of, a way to kind of like take some deep breaths. I think doing some breath work, helps too. Or it can just be like, I'm going to do some stretching, and, I've turned past 40 now. And so, things are different than they were, I'm not 20 anymore. So, it's just simple things like that. I think even if it's for 5 or 10 minutes, helps quite a bit.
Fantastic. Joe, any
building in opportunities. Yeah. Building those opportunities for reflection is, such a valuable thing. And it's so easy, like you said, 5 to 10 minutes, that it's sometimes so easy that it's easy not to do it. So I love everything that you just went through there. The idea of just, I'm going to take this time because it's going to make me a better version of me to then give back to everyone around me. And it literally can only take 5 minutes. It doesn't have to be like a whole thing.
No, it's we're a few years away from COVID. And so it's something that's really kind of stuck. And I think you're totally right. Like, it just puts me in a different perspective, a different little frame of mind. And so that, and then coupled again with doing some type of physical activity, and I think I've even changed my schedule a little bit to allow a little bit of time to go on a run, or, if I'm going to go to the gym or something like that, where you have a little bit of time to do that, not only for physical, but then the mental side of things too, with, what we've already talked about, the meditation or just the self-reflection. I think it's really made a big improvement just overall for my, sanity and happiness and well-being.
Well, Kyle,
that's awesome.
This has been 40 minutes of just great advice and discussion. I'll give you last words on the profession about podiatric medicine. What do you think about the future?
Every year, when I return or I go to the kind of annual ACFAS meeting, I am so blown away with where our profession has come from and where it is going. And I am so happy to see the quality of residents, the quality of research in our young members. It's very exciting. So I have nothing but a positive outlook for our profession.
We see the same thing at the college. Students are coming in. They're very worldly. Back when I went to school, there wasn't as much readily attainable information. So they come in, they know what they're getting into, and they make the most of it. We're really proud of them, and we're super excited about Friday when they find out where they're going to do residencies, and it's kind of that buzz in the air,
Yeah. I think we're heading in a great direction as a profession, and I think it will only improve. And it seems like it's like exponentially getting better, right? Like, it seems like that curve is like.
It's about to just totally take off.
Yeah.
Fantastic. Joe, anything else on your end?
No, I think that's a beautiful, beautiful segment to close on.
I do too. Well, Kyle, we're going to send you one of these Dean's Chat cups, and the hours you work, sometimes you're going to need a little caffeine or something, so you'll get that in the mail. And we really appreciate you taking time to join us on Dean's Chat and share your career experiences. Thank you so much.
Yeah, thank
absolutely.
you so much, Kyle.
Yeah, perfect. I'm looking forward to my coffee mug. That looks awesome.
Oh, there you go. Yeah, they're coveted.
They're like a collector's, like a thing.
Oh, really?
They're kind of a thing.
Nice.
So to all of our listeners out there on Apple Podcasts and Spotify, please give us a 5-star rating. And of course, if you're on YouTube, please become a subscriber. And until next week, cheers, everyone.